So good morning, everybody. Welcome to today's general meeting. How's everybody doing on this wet and dreary Tuesday? Yeah, okay. Everybody bring your swim fins to work with you today because we may need them to get home. Yeah, I see smiles at least. Okay, so we've talked about signing into the chat. If you would please turn your cameras on so that we can see your beautiful smiling faces. It's always easier when we're talking through Zoom if we can actually see faces instead of black squares with initials in them. And if you would remember to keep yourselves muted unless you're actually speaking, that'll help cut down on background noise. I know y'all been doing these Zoom meetings for a long time, so you know what the etiquette is. I'm just giving you some reminders. So the topic for today's meeting is elderly and disabled services. So today what we want to do is to provide you some resources for clients who may be elderly or disabled. The plan for today is to share some good information, not just from the speakers, but also from you guys. Remember, the general meeting is meant to be a time of networking and resource sharing. So if you know of another agency who provides these same types of services, please put them in the chat so everybody can have access to them. You know, we're out there in the field, we're doing all this kind of stuff. And so we probably know these resources better than anybody, and maybe not everybody in the meeting knows those resources. So if you can share them, it's really helpful to the whole group. So I would appreciate that, and so would everybody else. So getting right into the meeting, we have three different speakers today. Our first speaker is Kathy Stump from North Central Texas Area Agency on Aging. Kathy is a senior case manager at North Central Texas Council of Governments Area Agency on Aging. Her employer has a very long name. She has worked for the Department of Aging and Disability Services before being transferred to the Health and Human Services Commission. Kathy has extensive experience in Department of Aging and Disability Services programs, as well as the STAR Plus waiver program and Medicaid managed care. So Kathy, let me give you co-host capabilities so that you can share the slides that you said that you have with us.
Okay.
And there you go. And Kathy, you can take it away.
All right. All right. Can everyone see that? Okay. So thank you so much for having us, or for me today. I know Jackie works with me, but she works with the Aging and Disability Resource Center, and you'll hear from her in a moment. So I'm just going to kind of go over our key services that we have at North Central Texas Area Agency on Aging. And yes, you can say that 3 times fast. It is a tongue twister. And we do throw Council of Governments in there too, just to throw everybody off. So the purpose of our program is to plan and develop a comprehensive and coordinated system of services. We primarily target individuals over the age of 60 or their family caregivers. So we service a 14 county area. And I have a map on the next slide so that way you can see it. But we do, our programs are age-based. But we target at-risk populations. So typically low income, frail, isolated individuals, or in danger of premature institutionalization, which everyone knows that's a fancy word for nursing facility. So here is our service area. We service the 14 counties that surround Dallas and Tarrant. We do not service Dallas or Tarrant. Dallas and Tarrant each have their own area agencies on aging and aging and disability resource centers, which Kelly's going to go over, I believe, just Tarrant County with you guys in just a moment. So So we have several different service options, and each area agency on aging has very similar services, but some of the services may vary by area agency on aging just based on funding. So the ones I'm going over are the ones that we offer at our agency. So we have the benefits counseling program, care coordination, caregiver support coordination, long-term care ombudsman, and I'm going to go into detail on these services in just a few minutes. So this is just a very, very broad overview. We have the Aging and Disability Resource Center, which Jackie's going to go over. We have group setting and home delivered meals, also known as congregate meals or Meals on Wheels. We have transportation, information referral and assistance services, money management, caregiver education and training, the Home by Choice program, which is relocation services for individuals in the nursing facility who want to discharge back to their homes or assisted livings. And then we have evidence-based programs. So that's a lot of services that we have, and we have different individuals who cover each of those services, but each one of us is trained on generals. And so if you call our agency, we can give you general information and they get you to the correct person based on what you're needing. So benefits counseling, this provides consumers and their family caregivers with information about Medicare services, public and privately funded benefits like Medicaid and other options. They're really, really busy during open enrollment for Medicare, October through December. Because that's when most people need to change their Medicare plans. And it's always a good idea to have someone just go through those options with you because they're very detailed and they'll go over your health conditions, what you kind of need based on that, and then they'll give you the different options for you in your area. So they also cover Medigap, Medicare Advantage plans, Part D, prescription drug, comparisons. They also help with issues such as fraud, abuse, and consumer rights. So all of our services are generally over the phone. We can do email. We're not currently doing on-site clinics, obviously, due to the pandemic. We do hope to have those soon, but we don't have any information about on-site clinics at the moment. They can help with paperwork, with applications, appeals, and denials of benefits for both Medicare and Medicaid. So it's not just limited to just Medicare. They do referrals to community agencies, other organizations, educational presentations, such as just overview of Medicare benefits, and then the Senior Medicare Patrol Services, which goes over fraud and scams. And then they do volunteer training, certification, and supervision. We do have a lot of volunteer benefits counselors. They're a great asset to us. So if anyone's interested in that, you can get trained on that and become a volunteer benefits counselor. So they do also legal information, advanced directives, guardianship, consumer disputes. They can go over qualified income trusts, wills, and estate planning. So there is some funding available for limited assistance with attorney fees for simple legal documents like wills, estate planning, power of attorneys, and simple guardianships. We say simple, but we all know those don't quite go that way. And then again, our services are provided by staff. We have 3 excellent benefits counselors on staff, and then all of our volunteers are certified. So we also have the PEARLS program, which is counseling services for individuals. We cover all 14 counties, and all the counseling services are over the phone. I'm not sure if I mentioned, but all of our services are at no cost. So we do not charge for any of our services. So everything that we offer at the Area Agency on Aging is free to individuals. So we have recently started this PEARLS program in our 14 county area. And let me tell you, I have a couple clients enrolled in it, and it is excellent for them, especially because of the social isolation that people are experiencing right now due to the pandemic. So it's very helpful for those individuals. I've had really good feedback from the clients that I have enrolled in that. All right, we have some evidence-based programs, and we have A Matter of Balance, which is fall prevention, helps individuals manage falls and increase activity levels. It's used to be in person. Right now, everything is virtual. So it's 9 classes that they do. And it helps them, again, manage those falls and prevent those falls. And if they do fall, how to fall safely. We also have chronic disease, diabetes, and chronic pain workshops. It's typically 7 workshops. And again, it's all virtual currently. If we do go back to in-person stuff, all of these will be in person. So, all right, care coordination. So this is my program. I do the care coordination, caregiver support services. So we identify client needs and we coordinate temporary in-home services. Generally, our services are anywhere from 3 to 5 months, depending on the need of the individual. And for our care coordination, this is generally individuals who live alone or have very limited assistance with either caregivers or friends and family helping. So we assist in light housekeeping, residential repair, typically for accessibility. So those are ramps, grab bars, door widenings, that kind of stuff. We can do the rental of the emergency response system, which is the life alert button, help by falling and I can't get up. Anytime I say emergency response system, nobody knows what that is. So I say life alert and oh, okay. Life alert has some excellent marketing, let me tell you. We can also assist with limited prescription medications that Medicare doesn't cover if the individual is on Medicare. We can do medical supplies such as canes, walkers, wheelchairs, also incontinence supplies and nutritional supplements like Boost and Ensure. We do utility assistance, so we can pay gas, electric, and water, and propane, depending on what the individuals have. Since we cover primarily rural areas, we do have a lot of clients that are propane and other stuff. I know I've had to fill several propane tanks, which I didn't know they got that large. So you learn something new. So for our care coordination program, again, the individuals have a lack of caregiver support. We do have an income limit, but the individuals, they only have to meet 3 out of our 5 criteria. So if their income is over our income limit, then it's no big deal. They can, as long as they meet the rest of the criteria, then we can certainly service them. So right now our current income limit is $1,610 for an individual. A recent hospital or skilled nursing facility or rehab stay. We say recent, we kind of define that as 2 weeks, but we can go 4 to 6 weeks depending on what they were in the hospital, rehab, or skilled nursing facility for. We consider frail as impairments of 2 or more activities of daily living. So bathing, dressing, grooming, toileting, meal preparation. If individuals have Alzheimer's, memory issues, confusion, chronic physical or mental illness. So that's basically everybody. Most everyone meets that criteria. And then again, lack of caregiver support. And like I said, our services are generally up to 3 months. We can go up to 5 months depending on the individual and what their needs are. All right, so individuals who do have caregivers and the caregiver needs assistance, either with the care recipient or for themselves, we have our caregiver support services. So we identify clients who need and coordinate in-home services for those who have a caregiver who's having difficulty providing care. Either they need a break, or they're just unable to do it themselves due to whatever reason. Most oftentimes it's due to stress, or they're trying to go back to work, or they are working. So we provide the same services, care coordination, caregiver support. So it's light housekeeping, residential repair, again, accessibility, wheelchair ramps, door widenings, grab bars are the main things we cover. The emergency response system, prescription medications, again, not covered by insurance, that utility assistance, we can do those medical supplies. And we do have respite services, which just provides a break to the caregiver, because sometimes they don't need help with that light housekeeping. Sometimes it's just they need a break. So we can do general supervision as well. So it's kind of the same criteria, slightly different because we have the caregiver involved. So the caregiver, they need to meet at least 3 out of our 5 criteria. So the caregiver needs to have poor health or work disruption related to caregiving duties. When we say poor health, we mean stress. That counts as poor health because we all know how stressful it is to be a caregiver. The care recipient has no other help or limited assistance. The care recipient has been hospitalized, including rehab, skilled nursing facility, or within the last 2 to 6 weeks. The care recipient has impairments of 2 or more activities of daily living, or chronic physical, mental illness, or Alzheimer's, dementia, or any related disorders. And the caregiver lives in the same house as the care recipient. So as long as they meet 3 out of those 5, then we can provide assistance to them. So with our financial portion of that for caregiver services, it's a much, much higher criteria. So the caregiver household has to have an income of less than $60,000 per year. If they make more than $60,000 per year, then we can go for the care recipient's income, as long as they make less than $1,610 for that care recipient. So typically, if we can't fit the individual into our care coordination program because their income's too high and they don't quite meet that criteria, then we can throw them into our caregiver support services if they do have a caregiver or someone who's willing to say that they are a caregiver. Or if they don't meet either of those financial criteria, they have to have expenses that exceed the caregiver's or care recipient's income. Now, this is all statement-based. We do not require any sort of financials. They don't have to give us their bank statements or anything like that. We just ask them, do you make less than $60,000 a year, or do you make less than $1,610, or how much do you receive in Social Security or retirement benefits? And they tell us, and that's what we go off of. We do have one program that we call our Older Relatives Caregiver Support Program. This used to be called our Grandparents Raising Grandchildren program, but we've expanded it to kind of cover a few different options in there, as long as the individual's over the age of 55 and is caring for an adult child with severe disabilities. Because we've found that we have a lot more that fall into that category than just the grandparents raising grandchildren. And then, or if the caregiver has primary custody of the grandchild. And again, we don't require custody agreements or anything like that. So as long as they say they have primary custody, that's all we go based off of statement. And so with our older relative caregiver support, they need to be caring for a grandchild or child who's medically fragile or has special needs. The caregiver, we primarily focus on the caregiver in these instances. So caring for someone who has no other support, either paid or unpaid, and that the caregiver income is less than 150% of the poverty level, which right now it's 1,610. And that does not include the child or grandchild's income. So because sometimes they do receive income, we do not count that when we're screening these services. And so the older relative services, we can provide all the services we do, care coordination and caregiver support, but we realize that there are different needs when it comes to those. So we can provide vouchers for childcare, psychosocial counseling, legal assistance, and then financial assistance with school supplies and clothing, and then of course our benefits counseling. So those are the 3 programs or services that I cover. So if you have anyone living in Parker County, Wise County, or all the Western counties over there, I'm the case manager for that. So you'd be referring to me and I'd be helping them. All right, we have the long-term care ombudsman at our agency. So this provides advocacy for residents of nursing and assisted living facilities and their families. Because a lot of times it's not just the individuals, it's their families that are calling regarding that. And recently, we had a ton of calls because people weren't allowed in the nursing facilities or assisted living. So our ombudsman helped people navigate through that process. And as these facilities are reopening, they're helping the families, get visitations and helping them navigate that process and all the policies and procedures regarding that, because that changes daily. So they protect resident rights and resolving resident complaints. I know overheard them in a meeting, and they were talking about people complain a lot about the food at facilities. So that is one thing that they assist with is complaints regarding food. So it's not something I would have thought of, but you learn something new. So, and they help individuals choose facilities that are best suited for their needs. And so they can give you a list of all the issues with the facilities, and they can discuss which ones are best suited for your medical needs of your loved one. They conduct trainings for nursing home staff. And then they're provided, we have several staff ombudsmen, and then we have certified volunteers. All right, so here is our website information and also our phone number. If you need to contact us regarding any of our programs, call this 800 number. That's our main line. And then our receptionist will direct you to where you need to go based on the information you give them. I also included the ADRC, which is that 855 number, and Jackie will obviously go over that a little bit more. So that's all for North Central Texas Area Agency on Aging. Does anyone have any questions for me? Sorry, I was trying to talk fast to go over all this so I can give everyone else time to talk, because I know how it is when you have multiple presenters.
Okay, I'm not seeing anything come up in the chat. Nobody is volunteering. They have any questions?
Okay.
If y'all come up with questions or something, then feel free to drop them in the chat and we can get them to Kathy. Maybe she can answer them at the end of the time. So thank you, Kathy, for that. I do have a couple of follow-up questions for you.
Okay.
You gave the websites, but is there a particular person that we need to contact if we are interested in services?
It depends on what services you're wanting and what area the individuals are in, because we have case managers that cover different areas, and then and ombudsmen that cover different areas. So if you go to our website, it actually lists all of our contact information on there. So you can contact us directly, or you can just email, I believe it's Christine Tran. She's our main person, and she'll shoot it out to wherever it needs to go.
Or if they call one of those numbers that you listed and explain what services we're needing, then,
yep.
Then that we can be directed that way as well?
Yes, you'll get transferred directly to one of us.
Okay, so the getting in touch with the right person, I'm assuming, is going to be the way to get connected to just the services that we might need. Is that correct?
Yes, ma'am.
Okay. Is there a wait for any particular services? And if there is, how long is that wait?
So we don't have like waiting lists or anything. The problem we have is that we have a lot of referrals. So typically once we get a referral, we contact them within 14 days. So we have 10 business days to contact them to discuss anything. Sometimes we're a little bit quicker. Sometimes it takes the full 10 days. It just depends on how many referrals we have. And unfortunately, during this time period, we've been very, very busy.
Okay. Okay. All right. Thank you for that information, Kathy. We appreciate it. Next up, we have Kelly Kaiser with the United Way of Tarrant County's Area Agency on Aging. Kelly has worked with United Way of Tarrant County's Area Agency on Aging. Why, y'all's agencies are mouthfuls. Kelly's worked with them for the past 15 years, where she initially started as an intake specialist. She went on to work with the Aging and Disability Resource Center, or ADRC, since its inception in 2007. Kelly was promoted to a housing navigator for the ADRC and is passionate about assisting older adults and persons with disabilities with finding accessible and affordable housing options. So Kelly, if you're ready, let me give you co-host capabilities, because I believe you said you had a couple of slides you wanted to share with us.
Okay.
All right, you should be able to do that, and it's all you.
Let me see. I'm getting a host disabled participant screen sharing. Okay, there we go. There we go. Okay. So let me pull out mine. I will try to go through it pretty quickly. And let me get to the first slide here. For some reason, let's skip forward. Okay, so I am gonna, much like Kathy's program at the North Central Texas Area Agency on Aging, we are very similar in types of services, but there are some differences. One of those is that we are under, instead of the North Central Texas Council of Governments, we are one of the only area agencies on aging under the United Way of Tarrant County. And that has been as long as I have been with the company. So we're one of 28 AAAs in Texas and over 600 nationwide. Again, like I said, we're one of two in the US that's under United Way. We did receive $10.2 million of the CARES Act funding this year that came through. And that was based on our population from the HHSC. And a majority of our funding is actually covered by the Older Americans Act, which is a federal program designed specifically for people that are over 60 and their caregivers. Funding increasing, but it's not keeping up with the pace of the demand. Like Kathy said, we are very, very busy. And all of those kind of things. So we do provide, service navigation. Kathy called it care coordination, and we used to, but we changed our term. We also provide cognitive health, benefit counseling, the long-term care ombudsman, and the ADRC, or the Aging and Disability Resource Center. So our service navigation program, again, much like Kathy, it does services for 60 and older and their caregivers. And we just assess the need, navigate and arrange the services. And our services are short-term also, and they usually last about 3 months as well, depending on what they're needing. And then we refer to other resources. We also do some services with people with Alzheimer's and dementia-related diseases in their caregivers. And we used to provide services for caregivers and their families and loved ones with Alzheimer's and dementia, but now we are focusing specifically on those living alone. So we try to assess the need and coordinate services with them and provide what we call option counseling and resource planning. So just going over those community resources and long-term supports and services and things. And I'm not going to go through a lot of this since Kathy kind of gave y'all an overview of some of the same services, but we do provide benefit counseling. And they do a wide variety of things. They screen for those low-income help subsidy programs or extra help programs. Some of the same things. They, do Medicare appeals and just a lot of different things. Strangely enough, a lot of people ask for the advanced directives, so they also provide those as well. And another service we have is a long-term care ombudsman. And they actually advocate for residents in the nursing facilities and assisted living. They do provide information about how to find one, the quality care in them. They investigate and resolve complaints. And in Tarrant County, we provide oversight for 76 of the nursing facilities and 133 assisted living facilities. We do have several ombudsmen, and I think this is still correct. It might have changed slightly, but we usually have about 7 certified ombudsmen and roughly about 15 volunteers for that. So they go into the services. And I'm going to kind of just give a very brief overview. I know Jackie's going to talk more in detail about theirs. But we also have our Tarrant County Aging and Disability Resource Center. And that does serve primarily people that are 60 or older, or anybody that has a disability in their caregivers. So you don't have to be 60, but it's anybody with a disability. And basically what we do there is just provide information and resources, support services, and help them get connected to those agencies in Tarrant County. We used to be staffed by representatives from several partner agencies, but now it's primarily the United Way and Mental Health, my Health, My Resources staff that's providing the oversight. We are actually located in the Resource Connection inside the main center of My Health, My Resources on Circle Drive. And again, this is our main phone number to call, and you will be asked to provide a zip code, and whatever zip code you put in, you will be directed to the nearest ADRC. And again, these are some of the contracted services. I don't know, I think they mixed up the slides here. Sorry about that. These services for the Area Agency on Aging, these are some of the contracted services we have. Again, we do provide respite services and personal assistance, caregiver information services, nutrition services, much of the same things that Kathy mentioned as well. We do have a telephone reassurance program that is done, I believe, by one of our contracted providers, which I don't remember who that is. I want to say Yolo Mill, maybe. And then transportation. We have some special grants, and this is just depending upon the time of the year and the grant date. So some of these probably are out now. We do have a No Falls partnership for the falls prevention. We used to have, and I think we still do, workforce enhancement and healthy aging and independent living, and funding for discretionary grants. Our future plans include, COVID-19 nutrition plan, a COVID-19 long-term care task force, which has been meeting periodically, an Empower project, dementia-friendly North Central Texas, and we're working directly with that entity to provide dementia services, formation of statewide network, and then, just briefly, here again, our ADRC is much like the North Central Texas. These are some of our partners here with the ADRC. So we have contacts within these networks that we can call on. One of the things we have at our ADRC is options counseling and person-centered planning, and this provides specific help. It's a specific model for our navigators at the ADRC to help with options counseling, which is bringing services and moving services wherever they go. And that is just depending upon where they want to be, the service area. Maybe they're going back to work and they want to keep their benefits, how to be independent with disabilities and what that looks like after school. And generally that does start with an interview and then learning about the different choices that are available, creating an action plan, and connecting to services in a follow-up. So we do have several cases that come through that, and this is more for people with more complex needs. So they may have 2 or 3 different services they need connecting to. And then we have a person that provides information on nursing home rights and the rights that they have in the facilities. And they can share information about, here again, more different types of care, respite care. Now, our respite care through Area Agency on Aging, I will say, like Kathy did, that it does provide services for about 3 months, but here again, we have actually put that temporarily on hold. We don't really have a wait list per se, but because we've had so many referrals, they've had to get through those. So that's temporarily on hold until we get notified otherwise. So these are some of the other services we provide: option counseling for persons with disabilities. We just hired last year a person that is a disabilities navigator recently. So she takes on a lot of the population of the intellectual developmental disabilities and works directly through us, but she works in partnership with My Health, My Resources. We have a veteran specialist that works specifically with veterans. So she's always looking for ways to get into veteran networks for them, resources, all of the veteran services. They do provide some home modifications, some aid and attendant services, and other kind of navigation services. And our program also does pearls. And this basically kind of just breaks down, again, it's specifically for isolated individuals. And they usually do about 6 to 8 sessions, and they recognize symptoms of depression. And it's very specific. It's a 7-step approach to problem solving. So it's not just like talk therapy per se, but it's actually coming up with a plan and designating some actual activities to help that depression lift. So, and then my specific area advocates for housing navigation. And so I just go out and we do have 3 different listings along with a room and board home listing that we just provide to individuals that request it. We try to work with housing authorities, developers, and other professionals to create the accessible and affordable housing. And we just provide housing education to the community about the tenant rights, eviction processes, and everything other related to housing. So, and again, this is our information, the same number as before. So that concludes my presentation. Jenny, I'll hand it back to you. Are there any questions?
Could I ask a quick question?
Yes.
You had mentioned, thank you, by the way, for that info. You had mentioned a room and board housing list. Is that correct? Is that
Yes.
a special type of housing, or is that like room and board? Is that considered a special type of housing, or is that just like, apartment units as well, maybe?
Those that we have, it's not a specific licensed room and board list.
Oops, I think it might have muted. Sorry, Kelly.
Oh, sorry.
Oh, it's okay.
You're good, Kelly.
Can you hear me?
Yes.
Okay, there we go. So we do provide a list for individuals that may want just kind of more transitional, options. So that actually has come from a list that we used previously, and we're updating a previous list through My Health, My Resources. And we do get phone calls from people wanting to provide that to individuals. So we do encourage people to really think about that and really go out to the home, because sometimes that can get sticky since it's an agreement between the 2 parties. So we don't necessarily endorse them, but we do provide the options for them. So, and they're more willing sometimes to work with different incomes, but here again, it's a liability issue. So we try to encourage people to think about that. So.
Thank you.
All right. Any other questions for Kelly? Okay. We have one more speaker. Just a second. Okay. So our next speaker is Jackie. Oh, wait a second. Let me check. So Kelly, just like with Kathy's, they just need to call the number. There's not a specific person they need to speak with if they're interested in services.
Absolutely, yes. They just need to call that 855 number. We had a local number, but they are trying to phase the local numbers out. But the 855 number is probably the best way to get to us.
Okay, and then they would be directed to whomever they need to speak with for whatever program they need help with, and then kind of go from there, right?
Exactly, yeah.
Okay, awesome. Thank you. All right. So our next speaker is Jackie Helmer from ADRC. That's the Aging and Disability Resource Center. Jackie's been working with ADRC for about 3 years, and most of her experience is working in the nonprofit world. So she probably has the experience that matches what a lot of our experience is. So that may be a good thing. So Jackie, do you have any slides you need to share? Do I need to make you a co-host?
No, ma'am.
Okay, awesome. Well, it's your turn.
All righty. Hi, everybody. So what is ADRC? Aging and Disability Resource Center. A lot like Kathy, we serve the same area, the 14 counties. We serve anybody over 60 or with a disability. And most of our services are informational and referral. A lot of it is state-based services or local services. Most of what happens on my end is people call, and I get phone calls all day long from all 14 counties, and I help them with, they will ask, how do I get on disability, or how do I get on SSI? And I give them, mostly I tell them call a disability lawyer and give them the number to our legal hotline, because that's easier than going through SSA, especially right now during COVID. Also, I can help them with applying for the extra help, which is that low income help for prescriptions through SSA. I help explain the Medicare savings programs, and I can fill out the application for them over the phone and then send it to them for a signature. Or I can just talk them through it line by line, or just answer whatever questions they might have about the applications. And that's the QMB, SLMB, and the QI. Those are the Medicare savings programs. Same thing with the food stamp SNAP application. I can and do very frequently fill out the whole thing for them, then mail it to them for their signature. There's also waiver programs through My Health, My Resources. I have a lot of experience with HCS. And so I explain the HCS programs, the Texas Home Living, and the CLASS programs. Those are all waivers. There's also waivers through HHS, which is a Star Plus waiver. There's also the Community Attendance Service. A lot of the calls that I get and a lot of the phone conversations that I do are for the Community Attendance Service. I explain the criteria. I explain the process. I help them understand that 19-page application that I explain, you're going to get this in the mail. Call me when you do. I can go through that application. I explain the functional assessment and what that is for and how important that is. I can talk about some of the basics on Medicare. Most of the time when they're asking me more detailed Medicare questions, I will refer them over to the Area Agency on Aging benefit counselor. I can do the local referrals like the food banks or to Meals on Wheels, Texas Ramps. There's people who don't qualify for Kathy's program, so that's when I get the Texas Ramps and all those other programs in place. So like I said, primarily how I do my service is answering the phone and addressing each need as it comes. And that could be as various, just like what Kathy said, I need help with my rent. I need help with utilities. I need help with my modifications in the home. Most of it is I need help with my housework, or I need help with respite. I'm a caregiver for my parents or my aunts or uncles, and I'm burned out. A lot of what I do is talking through caregivers, the necessity for them to take care of themselves and how to do that. A lot of calls I get, the family members are panicked. They've never faced dementia before. They've never faced, my able-bodied mom was in a wheelchair 2 weeks ago, and now I have to give her a shower. I don't know what to do. I spend time with these folks and help them adjust to their new roles and give them the services that they need to help them adjust. Like Kelly had stated, we have the Community Care Options Program, which is folks that are discharging from a rehab, from a hospital. Those are the ones that come directly to me, and I follow them for 90 days. I make sure they get all the services, either state services or local services, county services. I interview them, find out what it is they actually need, develop a plan, and then I follow them for 90 days to make sure that everything is in place before I close their case. I think I've covered everything I have on my list here. I think that's it. Does anybody have any questions? I know I talked really fast.
That's okay. There's something in the chat. I'm trying to see if it's just a comment or if it's a question. Oh, Kelly has put something in the chat that she forgot to mention during her part of the program about a utility assistance program. I'm just going to leave that to everyone to read that. Jackie, thank you very much.
Wait a minute. I remember one more thing.
Okay.
I didn't flip my page over. The North Central Texas ADRC received some money from the CARES Act. So we have developed 3 specific programs that are related to COVID, and the people who are applying for these, the need has to be related to COVID. We do emergency rental and utility assistance for those who have lost work because of COVID. We provide emergency groceries for the same thing. And we also provide tablets and internet access through September of this year. And that is for those who are socially isolated and are having a hard time getting their groceries and medical appointments and all that. So those are the 3 programs. We don't really do the direct services except for these. And we also do the respite for those who don't fit with Kathy's program with the Area Agency on Aging.
Okay. All right. Well, thank you, Jackie. Are there any questions for Jackie? You can either drop them in the chat or just unmute yourself. Okay, I'm not seeing anything. I noticed that a lot of these services kind of overlap and are very, very similar, but each of the programs that were discussed have their unique things to them. So Jackie, is there a phone number, somebody specific that we need to contact to find out more about the services, to connect a client?
That phone number, that 855-YES-ADRC, that is the number to call, and you just put in the zip code, and if you're in our service area, it'll come to us.
Okay. All right. So just like for the others, is there a waiting list for any of your services?
No.
Okay. All right. Well, I really appreciate all three speakers today. Thank you very much for sharing your information with us. I hope that this has been helpful and beneficial to at least some of the people on the call. You never know when you might come across somebody who needs these services. So if you don't remember the details, at least you'll remember, hey, at that general meeting we talked about. So hopefully that'll be a good thing. Okay, so we do have a couple of announcements for you. First, let me introduce Katie Welch with TCHC, and she is going to share just a little bit of information about a COVID vaccine event that happened this past Saturday down on Lancaster, specifically for people experiencing homelessness, and about some scan card tags associated with that. So Katie, if you want to go ahead.
Yeah, thank you, Jenny. Yes, we were just going to give a quick update. So we held the vaccine event this past Saturday at the Vineyards, and it was the Johnson & Johnson vaccine that we were giving out. We were able to get 109 total people vaccinated with the Johnson & Johnson vaccine. And what we did, just for service providers and staff that are working with clients, we were able to catch the most people who had their scan cards. We put a green sticker on it with a check mark to indicate that they got that vaccine. And then I've been told that we are going to be working to get everyone else who has gotten a vaccine already prior to that and who are going to get one in the future, a sticker as well. But for now, those who got the Johnson & Johnson vaccine this past Saturday do have that sticker if they had their scan card with them. And then the only other thing I wanted to put a quick plug in was if you are working with clients who did receive that J&J vaccine this past Saturday, if you could just kind of, remind them that it wasn't put into the JPS medical system like it would have been if it was done at the clinic. And so if you just remind them that, they only need that one J&J vaccine, it was just one and done and they're fully vaccinated. And then just to hold on to their vaccination cards. They received a vaccination card when they left. Just in case they ever had questions, they can pull that card out and show it to a medical provider and that provider can answer their questions. So if you guys have any questions for me, you can always reach out as well. I'll put my email in the chat. So thank you guys.
All right, thank you, Katie. So my understanding, and correct me if I'm wrong, Katie, is the green sticker is just for quick eyeball. If you see it on their scan card, then you'll know that they've been vaccinated, right? That's the purpose of it.
I think that was the idea behind it. And then that'll be the idea moving forward when we put stickers on the rest of the clients who have received the vaccine. Yes.
Okay, awesome. So a quick, just kind of at a glance kind of thing on the scan cards for people working with people who are experiencing homelessness.
And there were people that didn't have their scan cards with them, so we were unable to give them a sticker. So it's not foolproof, but yeah.
Okay, awesome. Thank you.
Thank you.
Okay, and I have one other announcement from Kimberly Doty with Tarrant County Homeless Coalition. And Shannon, if you could drop Kimberly's email in the chat for me, I'd appreciate it. Kimberly is asking for all the case managers who have clients that are living in housing properties who've been housed. If you would please email her a list of those properties where your clients are living so she can reach out to the landlords and get them on board with the landlord engagement program. So again, case managers who have housed clients, if you would let Kimberly know who the properties are, what the properties are. She doesn't need a list of the clients, just a list of the properties, so she can reach out to those landlords and get them involved with the landlord engagement program. Okay, any other questions for any of our speakers or anybody else today, or anything about any of these topics? Okay, I do want to mention, I know that our numbers are a little bit down for this meeting, and I know there was some confusion about the link to get to this meeting today. I apologize for the confusion, but in our training newsletter that went out last week, we did let everybody know that there was a new link, and we put in big, bright, bold red letters that there's a new Zoom link. So the link that you've used today is the link for these meetings moving forward until further notice. So if you would just make sure you update your calendars or wherever you keep that link so that you'll be able to log in at the beginning of the meeting. I know several people came in late, but just to make sure that everybody is aware, this is the link now for this meeting until further notice. For those of you who came in late, if you have not signed into the chat, if you would please do that so we can have a record of your attendance. There is a notation in the chat. People will not be refused services if they don't have a vaccination sticker. So just so that everybody is aware, okay? So your people who have not been vaccinated are not going to be refused services. Okay, do any of you guys have any updates or anything for your agencies or programs or anything that's going on in your work that you need to let us know about?
Hello, this is Pierre Gant with the Mayor Group.
Hello?
Can you hear me?
Yes, go ahead.
Again, I'm sorry. My name is Pierre Gant with the Mayor Group. Tomorrow at the YMCA McDonald location on Marsby, there's going to be a mobile food pantry as well as a COVID vaccination of Pfizer shots, and it's open to anyone 12 years of age and older. So that one location will have administered the one shot, but throughout Tarrant County, you can go to your providers or any other place to get the second shot, but they'll have Tarrant County Public Health Department registering them, so they'll get that contact. So if you can get the word out, Shannon, I sent the flyer to you, and thank you so much for distributing it when you get a chance. Thank you.
Okay, thank you. Anybody else? Okay, well, we are like right at time to end the meeting. So I want to thank everybody for your attendance and your participation today. And if there's nothing else, we'll go ahead and adjourn for this month. Thank you so much. Bye-bye.